process. Okay, so Mr. Van Loon. Yeah, Mr. Van Loon.
Yeah.
So obviously we just went through the screening process.
Yeah.
I know why you're here. You had an exacerbation, I think 6 months ago,
I had
right?
I had a lung attack last winter.
Yeah, and you were hospitalized.
Yes.
So what's your goal for physiotherapy? Why are you here?
If I'm being honest, I want to know what I can do to help my condition. Because I smoked for a long time, but I also did stop smoking a long time back.
That's good to hear. Yeah.
Nothing much has really changed because I still feel breathless and I still feel worthless and I still feel dependent on everyone. So I think I kind of want to help that.
Worthless and dependent to everyone.
Yeah, sometimes with my wife, because I feel this condition has affected just our relationship a lot, and not in a bad way, in the sense she's still doing everything to help for sure, but I just personally feel that I'm being very dependent on her.
Okay.
Yeah.
So you're feeling very dependent on her. In what sense? So what are the things that you're struggling to do by yourself?
Could be anything, like just daily life activities, or let's just say cycling, for instance. I wouldn't even try cycling anymore because I know it's not possible. And I used to like going on walks. I still do, but it's so much less distance as compared to when I used to be able to. Yeah, because now it's just about like close to maybe half a kilometer, not even that much, and I'm already gassed out and like just breathing heavy and all that. So I guess I want that to change a little bit.
Yeah, I mean that's obviously understandable with these conditions. You're not going to be able to do that much without getting breathless, but there's a lot of research with apps, with medicine, with physiotherapy, that you can increase that threshold where you can do more. I want to stress that you're not worthless, you're not a burden to anyone. You will be able to do more with physiotherapy.
Thank you.
So I know that, like, okay, so impairments, you said walking, basic conditions, all that stuff. Do you work?
Huh?
Do you work?
No, I don't work anymore.
Not anymore.
No,
Okay.
I just sit at home near my window seat. So I like doing.
You like, okay. And what do you like about sitting at home?
It's nice to people watch and just look around. And well, initially it kind of was something that I was not really excited to do.
Yeah.
I've never been a sporty person, so I've never been like a proper outgoing, doing things kind of person.
Mm-hmm.
But when you sit on a window almost the entire day, it kind of does something to you.
Yeah.
In a way.
Yeah, understandable. So, just dive deeper. Do you know what your condition is?
Yeah, I do. I know that because I smoked a lot. My lungs are completely gone, and because of that, I got the device, the puffer as it was called, I think.
Yeah.
I don't even know what it does, and if I'm being honest, I don't really use it all that often.
Yeah, you don't use the puffer.
I mean, I do, and I remember it, but there are like many days where it just slips out.
Okay. Well, I mean, your puffer is quite important because it kind of opens up your airway. So, because I mean, there's a lot of air that's just trapped in there. That's why you get this kind of shape where like your chest looks big, and not much air goes in, not much air comes out. That's why when you breathe in, you've experienced it. I'm pretty sure. It's hard. It's to clear your mucus. It's to open up the airways a little bit, so the process is a little bit easier.
Okay.
Yeah. Okay. So it is quite vital for you to take those puffers.
Yeah. Okay. Understood. But like that's the thing. I was not even sure on what it does. So
I understand. It's a very confusing subject.
Why would you wanna it feels weird, the whole thing.
No,
it's just unusual to do this.
Yeah. I mean, I can teach you later actually how to breathe it in.
True.
But yeah, your medicine is very vital for this. It's to open that, as much as I would say everything kind of correlates to improving. I mean, we need to make sure that you understand what medicine you're taking and why you're taking it, so you actually do take it every day.
Yeah. And
then the treatment process, I mean, for you, I would do maybe a little bit of strength training, and also just a little bit of cycling, walking, whatever you're comfortable with. You can start off with just walking and then maybe you can go into cycling a little bit later. So before we even get to that part, you said that you feel like you're a burden. I've said that you're not, but maybe if you're comfortable, do you want to dive deeper into that?
Yeah, sure, we could. I mean, it's not even because, like I said, I used to go out on walks and things like that,
Yeah.
and I just don't like the fact that I'm not able to do it.
Yeah.
Everyone who's around me supporting me, especially my wife. She's a gem of a person. She's been supporting me
That's good to hear.
perfectly throughout. But at some point, you start to realize yourself that it's not that she called me a burden. I don't think she ever would, even if she wanted to. But like, I feel like a burden. I feel like I'm more dependent on her for everything. That's why I feel like I'm a burden. And there are some gatherings and social meetings and things like that, that my wife arranges or I arrange, or depending on old friends and things. And sometimes I forcibly don't go to those meetings because I feel like I would be a burden, or I feel like I would be like, why would somebody want to associate with me because I'm not able to do anything?
Yeah, understandable, definitely. I get that. So what you're telling me is that you kind of shy away or not really do social gatherings because of your condition.
Yeah, because I feel it could be like
A burden. Yeah. So what makes you actually feel like that? Is it just that your wife is gonna have to take care of you, or that your friends are gonna see that?
The dependency
Yeah.
is the main fact.
Yeah.
Being able to do everything yourself, and suddenly you walk in like you're a child with a babysitter. It doesn't feel that good.
Yeah.
It feels weird.
No, I get that completely. This condition is very hard for patients, especially when you've been hospitalized, and I mean it's quite serious. I mean, even some of my friends, they smoke, and I tell them don't smoke, and it's good that you actually did stop smoking, because it really does help with the contribution of getting better, because like it's like I tell my friends don't smoke because this could lead to COPD or anything like that, and they don't take it serious. And I'm not saying that you didn't take it serious, but now you're in this position where you kind of feel like you can't do as much as you want to, and I completely understand where you're coming from, but I do want to make sure that you know that with treatment and what you're doing now, even coming to physio, trying to understand your medication, it's a really good thing that you're trying to do. So I don't see your wife here. That's the first step.
Thank you. Actually, on that note, she actually did ask me to ask you something very important. So there are apparently some apps and things like that for my health, or something like that, that reminds me to take my medication, or that reminds me to do my exercise. And but she thinks that I would be pretty good at it because I know how to use a smartphone pretty well. So could you tell me, like?
So there is a lot of research on this type of condition, for just taking medication in general, just patient education on your thing, even helping you with training program at home, because obviously I'll give you some exercise at home, but it's not that fun when I tell you give you 5 things to do and you're not really going to do them. Understandable, but it kind of makes the training a little bit where I can evaluate what you're doing, and you can see your progress, so it kind of helps you being like, okay, I'm one step closer to where I want to be. So there's a lot of training programs we can use. I can find some. There's apps that our clinic use where you can use it. I can see your results, and it's just going to be a little bit more fun for you, and you're going to see your goal, getting your goal achieved.
Like progress.
Your progress. Okay. So what is your goal?
My goal is to, if I'm being honest, just to be less dependent and maybe do my daily life activities.
Again,
And like I mentioned earlier, the walking. Like I mentioned earlier, the walking. It was. I think that would be like a small, more like a heartfelt goal for me. I really want to be able to.
Just to walk without.
Yeah, because I used to walk the streets, just go for a stroll, see who's around, see which of the neighbors are come down and things like that. But like I said, the distance is shortened and it's a struggle to do it. So that's something I think, like on a personal note, that's something I think I really want to be able to do.
So I'm just gonna, because obviously I kind of understood what's going on. You're not doing as much as activities as you were. You're kind of just sitting at home because of your condition. You're not really doing the things you want to do, and also kind of removing yourself from social activities because of your condition, and you don't work, which yeah, and that's kind of leading you to this kind of conclusion that you're a burden to your wife.
Yep.
So I just want to ask you, on a scale of 0 to 10, 0 being absolutely not motivated at all, 10 being absolutely motivated, how motivated are you to actually use apps to be able to actually achieve your goals?
I mean, if I'm being honest, I can't really give you a proper answer to that because it can't, like, I don't know, I think it would depend on the app as such.
Mm-hmm.
But if there is one, like you mentioned, that, you know, that tracks how well I'm doing, and I can see it somewhere, I can look at a phone and see that, yeah, okay, I have done this, I think that would be really good. So I would give that, something like that, an 8.
Yeah.
But if it's more of an app where I'm just like, you know, because like I said, I forget to take my medication, so I don't know if an app specifically for that would help, because then I would just forget to look at the app.
Yeah, definitely.
And you know, at the age of 67, it's not like my, like, you know, brain's at the highest capability. So
Yeah.
if it's something easy, then I would say a solid 8 for sure.
Okay, that's good to hear. Okay, well, I think you're at the right place. You're doing what you need to do. So we'll carry on with some examinations, and then we'll get you on the training program. I will introduce an app to you and make it super simple for you. And I'll just also tell you how to use your inhaler. Is there anything that I missed that you want to speak about?
No, not really. Like, I just really hope it gets better.
Yeah,
that's about it.
It will. Yeah.
Thank you.
Yeah.